This program is a paid commercial announcement and in no way represents the views of WPHT or its management.
Talk Radio 1210 WPHT, WPHT HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
Good morning and welcome to the show. Just want you to know that Dr. Molly carried her shovel with us today, so that in case, because she used it a lot this week. But we're understanding that we're going to be in the 40s this week. So
we hope.
Right, and all is well.
All is well, at least all is well at our facility.
That's right, okay. Nice to have you with us as always. Sunday morning, we're here, 8 till 9. It's Health Watch. And as you heard the man say, Dr. Molly Fantasia, the PhD doctor, executive director, and founder of Innovative Medical Associates, Marlton, New Jersey, will explain what they do, how they do it, why they do it, and how it can potentially be helpful to you and anyone you know as far as your health is concerned. And, of course, we always take your questions at 855-839-1210, 855-839-1210. That's the number here in the studio, and at any time during the course of the show, if you have a question or a thought, feel free to talk to us at 855-839-1210. Let's get right into it, Dr. Molly. Innovative Medical Associates does what, and how is it different?
Well, here's the deal. Innovative Medical Associates is a collaborative of healthcare providers and people who really share the same philosophy, in that we are a work out of a primary care facility, which is mine. Everybody knows, And what we do is anything any other primary care facility can do. Like if you went into an urgent care, if you went over to the hospital emergency room, we can give you a medication, pharmaceutical. We can then check you out if there's an issue. We can do all that. But our philosophy is we want to do it all by using the least amount of the pharmaceutical agent and augment that with a natural substance like a vitamin, a mineral, an amino acid that is found naturally in the body, because we want to minimize the side effects of any of these pharmaceuticals.
Now, everybody asked you this in the initial consultation. Dr. Molly, is that better?
Well, I'm not going to say better, but it certainly allows you to maintain a better quality of life if you don't have the side effects. Let's take something like Lipitor or the statins, right? If there's a possibility that we can augment your statin and reduce the dose of it so that your cardiologist or your primary doesn't have to put you on the highest dose, but can put you on the lowest, do you think we can minimize that muscle fatigue and the muscle cramping?
Absolutely. You've done it for me.
You bet.
You've done it for me.
And so how do we do that? We do that by using the hydration, right? The hydration therapy, which is used to deliver some other nutraceuticals that may indeed help reduce the cholesterol.
Bottom line here is that there are many side effects for many pharmaceuticals.
Right, of course.
And your system, your protocols help to reduce those side effects.
Because we might be able to reduce the dosing, and in some cases, assuming it's medically prudent, we're able to take you off the medication entirely. So again, that's done with the doctors. The doctors, my physicians, I have fine physicians there. The joke was this week, 3 doctors, no waiting. It was like barbershop. In fact, I sent that out to my friend, you know who.
Yes.
and I, that's exactly right. But, the question becomes, is it safe to do it? Well, I can tell you that safely we have reduced the need for medication on many, many patients.
And I mentioned that. You did that for me.
Yes.
I was on one of the Lipitors.
Oh, my God.
Oh, and I remember I was on it for a couple of weeks. And in the morning when I got up, I couldn't walk.
Exactly.
Because of the joint pains and stuff.
And again, what I say is it's always risk versus reward. Now, obviously, if your lipids are so high that you're in danger of coming into a cardiac arrest or something, we've got to put you on something. I mean, the doc has to put you on something. The question is, can we arrest that portion of that condition, make it safe enough that utilizing the hydration works for the patient.
And eventually, you increased my hydration and did some other things.
Right.
And went on some natural things.
Right.
And I haven't been on any of those for a while.
That's great. And that's what we want you to do. I mean, the whole body. But again, the patient has to do their part too. Here's the other thing. This isn't holy water. We don't sprinkle it on you and then, miraculously, you're completely cured. It doesn't work like that. For example, you changed your lifestyle.
Yes.
You now walk a little more. You actually eat better. I mean, these are the things that we will help a patient do. And in addition to that, we're going to sit down with you, at least my wonderful Barbara is going to sit down with you and go over what other nutraceuticals may help orally in addition to the hydration. And why do we need that? Because you want to maintain a consistent flow of the good stuff and continue to have a therapeutic level based on what we give you in the facility.
By the way, your nurse Barbara didn't only make suggestions, she gave me a catalog.
I know that. I know that because she can tell you exactly how to get it, where to get it, when to do it. I mean, all of that. I mean, some women spend their time in Saks. She spends her time at vitamin stores.
That's right.
So it's a good thing.
It all works out,
It does.
especially for your patients. All right, 855-839-1210 is our number here. And again, it's Health Watch every Sunday, 8 till 9, Talk Radio 1210, WPHT. And, of course, Dr. Molly Fantasia is here. The PhD doctor, the executive director and founder of Innovative Medical Associates, located in Marlton, New Jersey. The types of conditions, the types of medical challenges that come across your desk, what seem to work best in terms of your protocols and helping patients?
I would say the chelation, the cardiac conditions tend to improve pretty well. Lipids tend to drop. I would say things like helping a person with their quality of life through chemotherapy or radiation therapy if they have cancer. And I absolutely would tell anyone who has an autoimmune condition to definitely come in and see us because we can improve your quality of life regardless of what the autoimmune condition is.
What did I tell you this morning? I said I didn't come in Thursday because you were closed due to snow.
Oh, it was terrible.
So I missed my drip. And I'm feeling with my back situation, it really is affecting me now because I didn't have a drip since Tuesday.
Right.
So normally, like 3-4 days after a drip, I'm okay, but I missed it.
Right.
And now I can feel it. So that tells you
And
something.
again, the rheumatoid conditions have been exacerbated with the cold weather and the dampness and all of that. So I've been seeing an increase with my patients who have the rheumatoid, whether it is arthritic or rheumatoid arthritis or whatever. We're really seeing some challenges with that.
I remember you've always talked about blood flow and how your chelation improved. We're going to talk about chelation later on in depth, but it improves blood flow, and what conditions generally are helped by that?
Let's talk about all conditions are helped by that. Remember, you have to pump your blood from head to toe, right? And what you want to do is you want to have enough blood flow to carry nutrients to your brain. So, for example, and you don't want to have hypertension, we want to make sure that the blood flow is going through the arterial system and the venous system in a way that's appropriate for a patient. And we also want to make sure that blood pressure doesn't get out of control. So there are so many things that chelation in and of itself can help us improve. It's amazing. Our cardiac conditions, chelation can improve men's health in terms of the sexual function. There's just so much that chelation in and of itself does. Plus, it's the particular amino acids I use after or during the chelation for specific issues that really helps.
Now, a lot of people come into you, and in the initial consultation, they say, I'm not sure, Dr. Molly, you can help me with my condition.
Right.
So talk about what conditions you can help people with, what challenges.
Well,
we could talk an hour for that, right?
Correct. Okay, we certainly can help people who've had some cardiac issues, hyperlipids, which means increased lipids, liver liver detox. We can help people. Yeah, I'm having a little challenge with one particular patient right now about migraines. And generally, we've been about 80% effective. And in this case, I'm having a little problem. And this gentleman is a pastor. So this weekend, I actually went back in to revamp my migraine protocol because I think I stumbled on part of his issue. And the migraines are as a result of lack of blood flow. So I'm thinking that I have to revamp this and utilize some of the chelators for him. Okay, not just what is used traditionally. Like if you go into the emergency room and you get an IV for your migraine, it's generally a magnesium. But there's some other little things I think I need to tweak for him to keep them really at bay. So these are the things: migraines, women's health. We're very open-minded. The homeopathics have specific help in specific conditions depending on what it is we're treating. And of course, people who have side effects from their chemo or their radiation, we help.
All right, we're coming up on our first break of the morning. Our show is Health Watch, Sundays 8 till 9, Talk Radio 1210 WPHT. Dr. Molly Fantasia is here. She is the PhD doctor and executive director, founder of Innovative Medical Associates, Marlton, New Jersey. Our number here in the studio, if you got a question for Dr. Molly, and we always tell you early is a good time to call. And last week we got them all in. So because people were, they were prompt in calling in early. 855-839-1210. 855-839-1210 is the number. With Dr. Molly Fantasia, I'm John DeMasi. We return. More of today's Health Watch after these words. Welcome back to Health Watch. As always, operators standing by at Innovative Medical Associates. And they're there right now. If you want to talk to them, maybe you're a little bashful, you don't want to come on the radio, you can call the operators, ask them any question, or if you want more information, they'll be happy to provide that for you. But the most important thing, if you're thinking, well, I wonder if Dr. Molly can help me. Well, it's simple. You make an appointment to sit down with Dr. Molly, and the initial consultation is complimentary, and you can get all the information you need right there. Pretty simple. 856-489-0505 is the number. And that, of course, is the number during the week as well. And the website, innovativemedicalassociates.com, innovativemedicalassociates.com. Our show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. Let's go to the phones. Armando is in Marlton. Armando, good morning. You're on with Dr. Molly.
Good morning, Armando.
Good morning. Thank you very much for taking my call.
No problem.
So the reason why I called in is I am suffering terribly with arthritis in my right knee. I was told by the folks at Rothman that I no longer have any cartilage between the femur bone and the lower bone. And simply, I can't even walk. That's how bad the pain is.
Armando, how old are you? Wait, how old are you?
I'm 56.
My God.
He's a baby.
Yeah. Okay.
Yep.
So, listen, are you asking, can I help with that? Obviously, if you have bone on bone, right? That's a little difficult. However, it would be quite interesting for you to bring your reports from the large organization that you went to. My doctors and I would love to see them. We can give you relief from this in that we can help you reduce the inflammation and also relieve some of the pain. Now, I have a lot of patients who've had problems, and of course, have they done anything for you like PRP or any of that and given you shots prior to this diagnosis?
I've had both cortisone shots and that chicken beak thing. I don't know what it's called.
Hyaluronic. Yes. What about PRP? Platelet-rich plasma.
I don't know what that.
Platelet-rich plasma. Have you had that?
Okay.
He doesn't know.
No, I have not.
Okay. Platelet-rich plasma is where we draw blood from the patient, right? It's spun down in a very expensive centrifuge, and we draw off a buffy coat, which is the platelets and the growth factors in that, and we inject that into the knee. Now, I can tell you, one of my doctors, Dr. Pat, was an anesthesiologist, and she's great with the needle. I gotta say that. She's really good with injecting it back into the knee. Now, that being done, we might be able to give you more relief than the hyaluronic has given you. And it can promote some growth in there. But we would really need to see your radiology reports, and that would be something I would want to look at. But I can even give you some short-term relief on your pain. Absolutely. No question. Actually, John has a problem in his back, in his lower back. And if you heard him this morning when we started, he said he really missed the IV treatment that gives him relief for 4 to 5 days. And so he comes in twice a week, and generally that lasts him for the whole week. Now, I'm not saying that that is a cure. It is not a cure. We would want to see your radiology. That's the bottom line. But I would try anything, man. I would try anything. And I know how that feels. What did you do for a living, Armando? Were you construction or something?
I was a VP for a technology company.
So you were running around a lot. All right. Okay. Listen, I think
46 weeks.
Oh, my God.
Oh.
Yeah, that'll do it every time, just the traveling alone, right? You know what? Come in and see us for the free consult. Will you bring your radiology? You're right around the corner from me. Come on.
Yeah,
Thank you.
that's right, Armando.
Thank
You're not far. You're probably neighbors.
Yeah,
right?
yeah. I mean, really, let's look at it and see if there's something else non-invasive that you can be done, you know? Thank you, Armando, for the call.
I'm going to ask my primary. I'm going to ask my primary to give me referrals to get fresh X-rays.
Oh, yeah, that's great.
Once I get that,
that's great.
Once I get that, I'll come in and visit you.
Yeah, and if you feel like he isn't going to give it to you, let me know. We'll have one of our docs write it for you. Come in for the consult. Okay.
We thanks, Armando.
Thank you.
Good luck
Bye-bye,
with that.
Armando.
Good luck with that.
That's a great question because I do a lot of PRP.
Right.
And we do a lot of stem cells. And here's the question, it depends on what's causing his issue, right? Because obviously we want to promote growth there. I'm going to tell you another story this week. We had a patient come in, very lovely woman, very smart woman. She works for Macy's in cosmetics. She's very intelligent. She comes in and she said there's nothing else they can do for her knee except do a knee replacement. Now, it's an interesting thing because Doctor and I went over the reports and we also looked back at the statistics for this. Here she had a meniscus tear. In other words, the meniscus is still operating, but it has a tear in it. Well, she's a good candidate for the PRP, and she's scheduled for PRP on Tuesday. And that we think she has a really good shot at having that repair done with the platelet-rich plasma, and with what I give her in the IV. I gave her a preparation IV last week, and this week what I want to do is I want to add the growth factors, the cytokines, the things that help those platelets sort of gel in there, and I think she's going to do okay.
All right, let's, because the gentleman just called and didn't know anything about PRP.
Yes.
In layman's terms.
It's platelet-rich
Can you explain
plasma.
the process?
It's so simple. We draw blood. We draw it in special tubes. We then spin it in a very special centrifuge. In other words, my lovely Linda takes it, spins it down.
I've heard that machine go.
Yeah, man. It's pretty expensive.
Yeah.
I have some expensive equipment. And we spin it down and then take the Buffy coat. In other words, the blood separates. When you spin it, you separate the liquid portion of the blood from the red blood cells, which are solid. And in there is another little white coat. There's a Buffy coat. That holds your platelets and growth factors and things that the blood use when it circulates to help repair the body. Well, we actually take it out in total and then inject it back into the area that's needed.
And that offers relief?
Well, given properly, yes. Given in an appropriate manner, it offers relief, and it may even repair the tear. So that's the key. So again, there is
without surgery, obviously.
Right.
Okay.
And what we're trying to do is it's not just putting the platelets back in. It's like your garden. In other words, what we're doing is we're planting the seeds, but then I water it through the hydration.
And the seeds grow.
Exactly.
Oh, how about that?
That's really cool.
That's an amazing process.
Yeah.
I've seen
I'll
you
tell
do that.
And
with
I'll
a few
tell you
patients.
something. Our process is better than what they're doing all over because it's bang, get you in, give you the shot and the help with you, right? Tell you what not to take, like don't take the anti-inflammatories because we're promoting inflammation, good inflammation to
solve the problem.
problem.
Okay.
But if you give it the proper nutrition, what do you think happens? Better outcome.
Absolutely. So it's like when you were saying about planting seeds, it's like putting a good kind of fertilizer in when you plant the seeds.
Exactly. That's what you need to do. I have found that nutrition, listen, God gives us this body, this wondrous body, but it's our job to give it the fuel it needs to continue to work for the duration of our lifetime. And that's where hydration really comes in.
I've seen some patients, they've gotten it, and you've told me they've gotten it, the PRP.
Yes.
What's the success rate? Is it?
Well, if you read the statistical success rate, I think it's about 70% across the country. I would say on a small group that we've done, we've had about 85% success. And I'll tell you, the best success we have is when people follow my entire program. Don't just come in and want the PRP because I don't even want you because I know that's not the way to do it.
That's a piece of it, right?
Right. From our perspective, without doing the rest of it, you might as well just forget about it. And I won't take your money. I just won't take your money.
And I've seen you do that, too.
Of course.
I've seen you
of course.
do it. Okay. We are coming up on a break. Our show is Health Watch every Sunday, 8 till 9, Talk Radio 1210, WPHT. Dr. Molly Fantasia is here, and she's ready to talk to you, and we do have some open lines, so good time to call right now. We still have plenty of time left on the show. 855-839-1210 is the number, 855-839-1210. With Dr. Molly Fantasia, I'm your host, John DeMasi. We return. More of today's Health Watch after these words. Welcome back to Health Watch. Operators are standing by right now at Innovative Medical Associates, and you can contact them. And you heard a previous caller who was going to make an appointment. So you can call right now at 856-489-0505. And if you think Dr. Molly can help you, all you do is make the appointment. The initial consultation is complimentary, and you can find out whatever you need to find out at that particular meeting. 856-489-0505 is the number. Innovative Medical Associates, Marlton, New Jersey, and the website, innovativemedicalassociates.com, innovativemedicalassociates.com. A lot of good information on the website as well. Our show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT, 855-839-1210 is our number here in the studio, 855-839-1210. Dr. Molly, you said something last week which caused some interesting conversations,
That's right.
we should say.
That's right.
Amino acids.
Right.
Can you
Amino
explain
acids.
this
Sure.
whole situation of what happened?
Because someone called me and said, you talk about your man-made amino acid, which is EDTA, is a chelator. I said, yes. He said, yeah, well, bodybuilders, I'm a trainer in the gym, and I know all about amino acids. I said, okay, great. He goes, well, they're for bodybuilding and muscle. I said, do you know that there are 50,000 proteins synthesized a day in the body? He goes, well, no. I said, well, there are. So let me explain a little bit about amino acids. Amino acids are the building blocks of proteins in the body. So it goes to show that if there are 50,000 proteins being propagated during the day, in one day on the body, amino acids play a part in that if they're the building blocks. And if you're lacking these amino acids, which, by the way, we give you in the bag in hydration, specific amino acids for a specific system that we're targeting, okay? Think about it. Can the body build or repair itself? The answer to that is no. So bodybuilders are not the only ones who should be on certain amino acids. Now, they have a place in helping people with different health challenges. They control the pathways that the body has to release growth hormones. For example, there'd be some amino acids that are in my drip that is used for the gentleman with PRP, right?
Right.
Because what am I trying to do? I'm trying to promote growth in that area. They play a direct role in the regulation of blood flow and blood pressure. They're precursors for neurotransmitters. Now, let's take that, for example. In other words, certain amino acids actually help regulate your blood flow, which then in turn, how would we measure that? By blood pressure. So are there amino acids that we give you if you have hypertension? The answer to that is yes. Yes.
So you're talking about amino acids, and I'm thinking it's kind of like when you buy paint. There's multiple kinds of paint,
right,
and there's thousands of colors.
That's right.
So this is kind of the same thing.
It is exactly right.
Amino acid is not just one thing.
No, it's not just branch amino acids that people who are in the gym are used to. Oh, BCC, well, that's what we use, BCA. We tune up your muscles. Of course you do. That's great. They support immune functions. They promote liver detox. So what do you think then? Do I use specific amino acids for people who have autoimmune disease?
Sure.
You bet. Do I use certain amino acids to help detox the liver? You bet. So there are so many. They're important from head to toe. So the benefits then are actually more than prevention of loss of muscle. They can decrease mental fatigue. Do I use it with people who have anxiety? The answer is yes. They can increase exercise performance. So am I saying to the trainer, don't use them? No. I'm saying use the appropriate amino acids, but there's a better way to deliver them through IV, and I have that particular recipe for folks who use this for athletics. And as you remember, I spoke about it a few weeks ago with my college athletes.
And you also, I remember, you had a bodybuilder patient.
Oh, yes.
And you used these kinds of things on him, right?
That's exactly right. But again, what do we want to do? We want to use these safely because this is a Goldilocks theory. Again, you've got to be just right. You can't be too much to one side. You can't be too much to the other side. It's got to be just right. And that's the advantage of using the hydration. Direct hit to the area or the system we're looking to improve, and we use an appropriate amount in relationship to other biochemical responses. So that's one of the things. It can promote weight loss, which we all know, and we actually have a weight loss injectable that I give people that definitely has amino acids. So then we can reduce muscle soreness, we burn fat, but to me, it's the marvel of amino acids. I mean, this is a God-given thing. When you look at amino acids and the vital functions it does for the body, meaning promoting things like your brain functions, promoting your blood pressure, promoting these kinds of things, I'm looking at what God has put together.
So I guess bottom line is, as you told me before the show, amino acids have many perspectives.
Exactly. So don't be fooled, people, by just going into the muscle building part of a health food store. And everybody knows what I mean. Every college athlete I know buys all these powders. What do you think they are? They're amino acids. But is that the best way to get your amino acids? No. And number two, yes, I have very much respect for athletic trainers. I think they're brilliant. But I want people to understand amino acids have a much greater role in the body than just the muscle mass and muscle improvement.
You know, you mentioned that the powders. You go into the health food stores, you see the one section, they got those big jars of powders. Yes. And all the guys in there, like some of the guys that work there, you can tell they're using some of those powders.
Of course they are. Of course they are. And you know what's interesting? There's a particular amino acid that we're using, which is called phenylalanine. You've heard me speak about this. We're using this with these neurotransmitter diseases, neurodegenerative. In particular, I've used it on a Parkinson's patient to help with the tremors, and also we use it for our MS patients. But again, it's what else you give with that actually makes the difference in the quality of life.
Do you ask people, or do you suggest to people, you mentioned earlier about changing diets and changing lifestyle.
Of course.
Do you mention that in this case?
Of course, because again, look, anybody who has MS knows that there is a very famous physician, Dr. Wells, and she actually cured, quote unquote, so she says, she cured her MS by following a very specific diet that included some amino acids, that included vitamin C, our old favorite, and some other things, but a very specific diet that helped her in her journey for MS. Of course, we tell people we'd like you to follow that diet as close as possible. But I had one who said to me, well, I'm not a nun, Dr. Molly. I said, well, I understand. I understand. So let me augment that with what we can do in the bag.
So this whole process of amino acids seems to have, as you said, many perspectives, and it also has multiple uses.
That's right.
And so not to think that it's just for muscle building.
That's exactly why I'm talking about this, because I think the gentleman who called me put me on the spot, or thought he did, in that he's telling me that, don't I know that it's used extensively for bodybuilding? Of course I know that. And I think it's a prudent use. But I want people to understand I'm using amino acids for conditions to help improve their quality of life in other conditions, like the things that cause autoimmune, like things like that. Even cardiac conditions, we use it because of blood pressure. So there's many, many things to use amino acids for.
One of the things I like about doing this show, now I never knew that. You taught me something that I didn't know about amino acids till today.
Well, I think it's something, you throw the word around, and, I think I'm guilty of this, and I don't tell you why we use it. But we use it for these kinds of things. We really, look, when I talk about improving your quality of life, I don't just want to improve your muscle mass. I want to improve your entire quality of life, right?
Exactly.
I want to improve your cardiac output. I have a case I told you about, and this entailed using some amino acids, where the guy came to us with an ejection fraction of 20. We now have it up in the 60s. I know there are things you can use these for. Use them appropriately. That's all I was trying to say. And I agree with the people who work at the gym and who are trainers. I am not against trainers. I'm all for it. All I'm trying to say is there are many other uses for amino acids.
Speaking of men and bodybuilding and all that kind of stuff, we're going to talk about men's health.
Yes.
And your men's health protocol after the break. It's our final break of the morning, which means you still have time to jump in with a question or a comment for Dr. Molly. 855-839-1210 is our number here. 855-839-1210. Again, if you have a question or a medical challenge you want to run by Dr. Molly, we have a couple of minutes left of the show. Time for one or two more questions here on the program. Health Watch is the show. Sundays 8 till 9, Talk Radio 1210, WPHT. Again, with Dr. Molly Fantasia, the PhD doctor, executive director, and founder of Innovative Medical Associates. I'm John DeMasi. We return more of our health show for today after these words. Back here on Health Watch, and again, operators standing by at Innovative Medical Associates. And if you want to contact them to get more information, or if you want to make an appointment with Dr. Molly, the number is 856-489-0505, 856-489-0505. And just because we leave you at 9 o'clock doesn't mean the operators go home. No. They're there all day.
The office is with us.
That's right. Exactly right. 856-489-0505. So you can call after the show, or you can call tonight, you can call tomorrow morning, but they're there all week, of course. 856-489-0505. Innovative Medical Associates, Marlton, New Jersey. And the website, innovativemedicalassociates.com. innovativemedicalassociates.com is the website. Again, Health Watch is our show every Sunday, 8 till 9, Talk Radio 1210, WPHT. We're going to talk about men's health, Dr. Molly, and very interesting, part of the men's health protocols and the whole procedure that you do is this acoustical wave, and that's very interesting.
And
talk about that.
Yeah, the acoustical wave is a wavelength that the instrument puts out. When you turn it on, you sure can hear it. You can hear it. It sounds almost like a CT scanner if you were laying there.
Yes.
Not quite, but almost. And it's the wavelengths that go in and work on the shaft to break the old blood vessels down, open them up. It's also used to break down plaquing, used to break down any scar tissue, those kinds of things. And I agree that that's very, very important. I agree with that. But I think it's only half the battle. I think the other half of the battle, of course, is to increase the blood flow, because I say this over and over again. You need 40 cc's to sustain the erection. And in order to do that, you got to have more blood flow from the cardiac. So anyone who's telling guys, oh, well, this will work. Yeah, it works. You will get one, but honey, you're not going to sustain it. And there's the problem. In there lies the rub. And it lies the rub for your partner. Trust me, women are the ones who've come and said, Dr. Molly, he's spending all this money on this acoustical wave. And yes, it's working, but it's really not very long in terms of length of time that he's able to sustain it. Well, that's no good. That's not what you want to do. And I'm all about relationships. So I started looking at that, and I said the missing piece is the blood flow. You need to have the blood flow that gets down to the genitalia. And I think that the way we're doing it is probably going to revolutionize all of this. It really is. Because I'm already seeing improvement in my patients much quicker than the guys who are just doing the acoustical wave.
All right, so you're doing the acoustical wave and
plus
then
a hydration that entails chelation
right.
to improve the blood flow 12% by body surface. Okay, that's a big number, John. It's your body surface, head to toe.
You've often talked about that.
Length
yeah.
and width,
right.
Okay? So that's the key to this. And I believe that the way we are doing it is going to really, I'm working on putting the protocol in and actually putting a process to patent the protocol.
All right, so people come into you, Dr. Molly, you know, I hear all this stuff, and you're doing this, you're doing that. But I could just get the little blue pill, and that's going to fix it.
No, it isn't. No,
okay.
it isn't.
Well, that's I know
what
that's what the thinking is.
That is the thinking, but no, it isn't. How many people have failed on the little blue pill? But, by the way, if you need the little blue pill, we can give it to you in various doses. We can do it in a way that's compounded for you, so you get the active ingredient. We can do it along with compounding some testosterone for you. There are shots that can be given if you want them, okay? There are many, many things that can be done. But the point I'm making is, what's the difference? If you don't have the right blood flow, and let me tell you, you're going to have more problems than just your erection if you're not getting enough blood flow. And I would tell you in 80% of my patients, they have a comorbidity that is contributing to the problem.
Like diabetes?
You bet.
Okay.
Like diabetes, like cardiac, high blood pressure, all these things. So I would tell any woman out there who loves her man to say, listen, you need a complete cardiac workup. You need to have more than just the urology workup. Yes, that's important. I agree. Prostate problems, important. How about the poor guys that are post-cancer? Not just prostate cancer, just cancer in general. You don't think that maybe some of the cancer treatments reduce their blood flow in other areas? You bet, because they have some cardiac implications. So there are ways to improve a guy's quality of life systemically, thereby helping him, and at the same time using this new technology on the area that is needed. But I say you need to look beyond that.
All right, let's talk about the length of time for all of this to happen. So a person signs up for your men's health protocol.
Right. They're going to need at least 10 treatments of the hydration along with the acoustical wave. And so we package this so it's the acoustical wave. When they're getting their hydration, then they can also get the acoustical wave.
So this whole process is
Good 10 weeks.
10 weeks for
roughly.
both.
For both.
Acoustical wave and
right.
protocols.
We put it together because it just didn't make sense to me to do it another way. The acoustical wave will also bring blood flow to areas, which is why, by the way, it can be used to help women with cellulite. It can be used in a sort of physical therapy type of process, although it's not a covered modality, but you can use it on breaks. I read a very interesting article. I'm starting to use it on my arm. So it can be used for tennis elbow, so it has an application for athletes. So there are many reasons the acoustical wave can be used in other applications. So it isn't just for quote-unquote men's health.
You know, it's interesting. You know that I used to host a weekly health show with different doctors.
Of course.
And every doctor said the same thing that you're saying about ED. Blood flow is significant. It is key to the whole situation.
Right. So the acoustical wave brings blood
Right.
there, but you see that these guys are going for how many weeks? They go for treatments, I think they said 6 weeks, but 2 times a week. I don't even know. And are they really getting the sustainability? And the other thing is, let's look at this. In many, many cases, it isn't just a problem in the area. That's what I'm really saying.
Yeah. So it's as with everything that you do, it's a comprehensive program.
Right.
So you get a little bit of this, you get a little bit of that, and
we try to put it together, and
right.
make sure that, guys are happy. And more importantly, their partners are happy too.
Okay. That's the note we're going to end the show on because we are out of time. How about that?
Again.
Okay. Just when we get on a roll, we'll have to get.
That's right. We need a 2-hour show.
Exactly right. Okay. That's going to put the wraps on another edition of Health Watch. Don't forget, operators are standing by right now, and they'll be there well after we leave you after 9 o'clock at 856-489-0505. That's the number for Innovative Medical Associates, Marlton, New Jersey. Again, 856-489-0505. Call and make your appointment to sit down with Dr. Molly. Remember, the initial consultation is complimentary. And the website, innovativemedicalassociates.com, innovativemedicalassociates.com. For Dr. Molly and everyone at Innovative Medical Associates, the lovely Linda. We have Barbara, delightful D, Joanne, fabulous Fran, and our nurses, Jess and Crystal, and our medical assistant, Chatty Cathy. Okay. I'm John DeMasi. Thanks for listening. We'll talk to you next Sunday. Health Watch, 8 till 9. Talk Radio 1210 WPHT. You take care.